The following portion of Daytime Blue Ridge is sponsored by
More than 1 million people in the United States have an eye condition called wet age-related macular degeneration. Nancy Holekamp is an ophthalmologist, and she's here with more. Thanks for joining us. And first off, just tell us some of the symptoms of wet AMD.
Well, the symptoms can begin with blurred or distorted vision, first in one eye, but in many people, it ends up affecting both eyes.
Oh my, and it doesn't happen until you've reached a certain age, correct? So somebody like myself that's under 50, you should be in the clear, but once you hit a certain age, you should be more aware?
Yes, so it's an age-related degeneration of the center of the retina that corresponds to reading vision, driving vision, 20/20 vision. And in fact, we usually see this diagnosis after age 50. So it's recommended that everyone over the age of 50 have a yearly comprehensive eye exam. And if you have a family history, be sure to mention it to your doctor.
Yes, I actually do have a family history, so I'm like listening with all my ears because eyes are so precious. Sight is so wonderful, and I do not want that to, by any means, be hurt. So, okay, what are some of the ways that you can treat this?
Well, the current standard of care for treating wet age-related macular degeneration are injections into the eye of medications that take the wet macular degeneration and make it dry again. Unfortunately, these injections can be needed as frequently as every month. And it's just so hard for older Americans to get to their eye doctor so frequently for these treatments that sometimes they're not able to be consistent with the treatments that help protect or preserve their vision. So definitely newer, innovative treatments are needed.
Okay, and then if you don't have any symptoms, do you still recommend scheduling an eye exam?
Yes, absolutely. Everyone over the age of 50 should have an eye exam, but we're now very fortunate that there is a new treatment called Susvimo that releases ranibizumab into the eye of patients with wet macular degeneration for up to 6 months. And this means that patients can maintain their vision with as few as 2 treatments a year. Now, Susvimo can be associated with risks such as eye infections, but I recommend everyone see their eye doctor and talk to them about what treatments might be best for their particular situation.
Okay, well, thank you so much for coming on and filling us in today. For viewers at home, we're going to pop up the website for more information. It's right there on the screen.